In this video, we are going to see one of the important lymphatic structure of the abdomen, that is the cisterna chyli. This is a view of the posterior abdominal wall with the major lymphatic structures. In the upper part, you can see the posterior thoracic wall also, but we will focus mainly on the abdomen alone. Cisterna chyli is a dilated lymphatic sac, and the length of the cisterna chyli is around 5 to 7 centimeter. Before going into the cisterna chyli details, we need to understand the structures shown in this view. This is the diaphragm, and we can see the esophageal opening over here. This is the right crus of the diaphragm, which is seen in this area. This is the abdominal aorta. This is the inferior vena cava, and a part of the inferior vena cava is removed in this aspect. This is the median arcuate ligament, and we can identify the entry of abdominal aorta is through the median arcuate ligament. So this will be the level of L1 vertebrae. With this in mind, we will focus on our topic of concern, that is the cisterna chyli. Here it is. This is the cisterna chyli. It is situated in front of the upper two lumbar vertebrae. The cisterna receives the collecting lymph from most of the abdominopelvic organs, abdominal wall, and from the lower extremities. In addition, it receives about 60% of absorbed fat directly from the small gut through the intestinal lymph trunks. You can see the intestinal lymph trunks along here. You can see the lymph trunk over here, intestinal lymph trunks. The cisterna is continuous above with the thoracic duct through the aortic opening of the diaphragm. We have already identified the median arcuate ligament over here. This is the aortic opening, and through the aortic opening along with the right side of the aorta, we can see the continuation over here, that is the thoracic duct. There is a divergence of opinion about the interior of the cisterna, whether single chambered or multiloculated. In some subjects, the cisterna is not discernible also. Now we will focus on the relations of the cisterna chyli. On the right side, we have the right crus of the diaphragm, which is positioned over here, and also we have the inferior vena cava. We already understand this is the cut end of the inferior vena cava. It was located in this particular area. So that will become the right side relation of cisterna chyli. On the left side, as we can see clearly from the diagram, there is abdominal aorta. In front, the cisterna chyli is overlapped by the edges of the right crus of the diaphragm over here, and in the front we will have the head of the pancreas. Behind, there will be vertebral bodies of L1 and L2 vertebrae, and these vertebral bodies are separated from the cisterna chyli by the upper two right lumbar arteries and right lumbar azygous vein, if it is present. Now we can move on to see the tributaries of the cisterna chyli. It receives, as we already mentioned, the intestinal lymph trunks from the pre-aortic lymph nodes. We can see the pre-aortic lymph nodes in this area, and the intestinal lymph trunk is shown clearly here. It receives the intestinal lymph trunks. That is the first tributary. The second one, that also receives the lumbar lymph trunks from each of the para-aortic lymph node groups. We can see the right lumbar lymph trunk over here, and we can trace the left lumbar lymph trunk over here. So this will be the major tributaries of cisterna chyli. Thank you for your patient listening.